Buenas tardes, mi nombre es Wolfgang González, soy residente del Instituto Nacional de Nutrición. El día de hoy tengo el gusto de entrevistar al Dr. Zhao. Dr. Zhao, thank you for being here. Your work in urethral and endometrial reconstruction is known worldwide, has changed many of us how we think about tissue handling, robotics, and functional outcomes. I want to focus on your decision making and your innovations. When choosing between excision primary and anastomosis and graft augmentation, is there a clinical nuance that most helps you tailor the treatment of patients?
Yeah, so the question between direct anastomosis and putting a graft depends quite a bit on whether there's already a lumen that I'm trying to augment, because generally we want to have a narrow opening that we open and we put a graft on. We also, the other question is for me is there a bed for the graft to take? And so, for example, on the ureter, we will often use the omentum or the psoas muscle. There's situations where, for example, there's a problem right over the iliac vessels. Placing a graft there may be difficult to do because you can't put a graft right on the vessel itself. And so in those cases would be ones where I prefer to do anastomotic.
Okay.
Yeah.
All right, thank you. What technical principle has most beneficial for surgeons beginning, like us, to adapt robotic reconstruction?
Okay. I think the most important thing is care with tissue handling. It is pleasing from an aesthetic standpoint to really dissect everything out, but with every bit of dissection, you're paying a price in potential risk for injury as well as problems with the blood supply. And so you want to identify only the parts of the anatomy that need reconstruction and move as little tissue as you need to repair.
Finally, for residents interested in reconstruction, which mindset or skill best accelerates safe and effective surgical growth?
Well, I think reconstructive surgery is a subset of surgery in general. And many of the things that I do, were not primarily based on reconstruction. My experience in robotic prostatectomy really helped me learn how to reconstruct the bladder neck. My experience with partial nephrectomy helped me with reconstruction of the upper tract. And so I think for trainees, the most important thing is to get as good as you can in surgery of all aspects.
All right.
Not to focus only on reconstruction, because I think the reconstruction is the result of skill in many other fields.
All right. Thank you very much for your insight, and we'll be pleased to have you any other time.
Okay.
Thank you very much.
Thank you.